Michael, when we meet with patients, we have to wear masks, but veterans don't, so
Okay.
we're gonna have our masks on, okay?
Do you prefer to have a mask on or off?
No, that's fine.
Maybe we'll do in-person introductions, and then everyone who's called in or is on Teams could be introduced.
Yep, so we doing it now?
Yeah. go ahead.
You know me, Andy Aaron, primary care provider.
So Lauren Danzig, I am the registered nurse care manager that works with Andy, and I've talked to you a couple times on the phone and on secure messages
Correct.
before.
Yes.
I'm Trevor Stryker, I'm the post 9/11 military VA case manager. I spoke to you that one time.
Yep.
And Heidi Gott is the case manager you were normally working with.
Correct.
She is in the recruitment right now, I think she's planned on coming here, so, yeah, I provide case management similar to what Heidi does.
Okay.
And I'm Bryce Dietz. I'm one of the mobility managers for Veteran Transportation Service. I cover the Grand Island, Holdridge, Hastings, all this area over here.
Okay, sounds good.
Michael, I'll turn my computer around so you can, I don't know if that helps you to see or hear
Yeah,
better.
yeah, there you go. That's fine.
Can you see, sort of?
Yep.
Yes, just say I'm on Teams. I'm George Bierce. I'm the Department of Veteran Affairs for NWI VTS Chief. So I cover all of NWI for transportation.
Okay.
And I'm Sally Cox. I work with South Central Behavioral Services. I'm representing Ashley Allen and Lisa Stitt.
I'm on the show. I'm not on the video. I could get Teams to open, so I had to do the call-in deal.
Okay.
I'm just there. Michael's there, but
Is that everybody?
That's everybody.
Okay.
All right, am I gonna run the show?
Sure.
You gonna run the show?
Yeah, go
Okay.
for it.
So, I guess we're all meetings with the common goal of trying to help Michael. We want to get his pain under control, and we just want to help you. So that's why we're here, okay? So maybe if you could tell us all, like, what are your goals with this meeting, and then we all want to work together and get there,
Simple terms, get everybody on the same page
okay?
so there's no miscommunications
Okay.
anymore.
Sure. Sure.
Because I'm getting so many different answers. I just wish somebody from Care in the Community would be here because their system is jacked up worse than,
Okay.
like, it's bad.
Okay.
Laura, I can't understand what he's saying.
Okay. Michael, could we maybe scoot you closer?
Yeah.
So you might pick up our microphone better, is that okay? And then maybe we'll have to talk a little louder. So Michael said that his goal is to get everybody on the same page. He said that he had hoped that someone from Care in the Community from the VA could have been here. He said that the system is kind of rough in the way that it operates for Care in the Community. So I think that we all have the same goal, just get on the same page. Do you have anything else that you want to add, Michael?
I'm kind of just open to hear what you guys have to say,
Okay.
what's been talked about, figured out, what,
Absolutely.
Yeah.
Okay. So get everybody on the same page. So can you give us like some specific goals that you're hoping with this meeting? I think getting your pain better controlled is like a huge one.
Correct.
Correct. Okay. So pain control.
definitely.
Okay. Can you give us some more specific goals that you're hoping to attain?
Steady, constant care,
Okay, that's fair.
not here one day a week, and then next week it's 2 days a week, and then a month later it's one time, and then 2 months later, it's another time.
Okay.
That's not gonna help nobody.
Okay, so, more, I think what I hear you saying is like more consistent appointments? Is that what you're thinking?
Well, I have consistent appointments,
Okay.
but transportation gets in the way and
Yes, okay, so, okay. So transportation has been a hindrance, okay.
7 appointments in the last month and a half, 2 months, something like that.
Okay,
Don't quote me on the exact
Yeah,
numbers,
that's
but
okay.
it's been at least 7 to 8
Okay.
appointments.
okay.
And then they fired the massage therapist, they fired the acupuncturist. So there was several weeks there where I didn't have any appointments, no
Yeah.
relief.
We have a little bit of a lull, I'm sorry, I'm kinda taking notes as he's talking too. Are you able to hear him better now, Sally?
Yes, thank you very
Okay,
much.
yes, of course, absolutely. Okay. So pain control, steady constant care with transportation being, something that's been a hindrance. What else?
There's miscommunication between the outside providers and the VA.
Okay. So VA and outside miscommunication. Can you give me, an example of that?
Like we were talking on the phone and Dr. Aarons was saying there was C2 through C6 if I remember right. And then the epiduralist is treating thoracic and not the cervical. And I asked him to figure out what was going on, where's the miscommunication. He told me it wasn't his problem, it was mine, that I'd have to figure out it.
Okay.
That's not true.
It's
Okay.
on YouTube if you
Well,
wanna listen.
It's your problem.
It's on YouTube if you wanna
Let's do
listen.
this.
Already did.
Let's do
Okay.
this. Let's not get lost in the, we all have the same goal, right? In the outset of this meeting, we stated we have the same goal. We wanna get you help, so.
And don't tell me I'm lying.
Okay, I agree. So let's just leave that on the table. So whether we interpreted it different ways, let's work towards our goal, okay?
Right, cause see,
So
I
you're-
have social pragmatic communication disorder, dyslexia, all these other learning disabilities, and nobody's giving me any concessions. They treat me like I'm normal, and like, it's making my PTSD worse. Like, nobody seems to care, nobody's making it any better,
Well, I care.
and
And
hopefully
thank
we
you-
can make this better
Yes,
then.
thank you for sharing that with us. Thank you. We may not always know the best ways to help you, so I am very open to suggestions. So if you need to pause and say, I need this to go a different way, please tell me that, okay?
Okay.
Okay, so your C2 to C6, is what PA Aarons was treating, and then, a different area, the thoracic spine, was going to be treated. Is that what you said?
I had been treated for
Had been
thoracic.
treated? Okay,
Yes,
It was just FYI only, it's nothing I was treating.
okay.
what's that, what?
Just for your information.
Oh,
It was, you're being treated for the C-spine, the thoracic spine, which we knew. The imaging also showed that there's abnormalities in the cervical spine, which is just additional information, for your knowledge. And it could be important as to the overall, pain control or lack of pain control. So, yep, we want the T-spine treated, and it was just, information only. The C-spine, the cervical spine.
okay. So the pain going up into my neck isn't caused by the degenerative disc disease, if I remember right?
I'll let that up to the pain doctor.
That's another thing.
Yeah.
Who?
Who is he
Because-
seeing for
Dr.
pain?
Albers.
Dr. Albers, so pain is Dr. Albers.
Yeah.
But
Can you, my computer, I have my camera on, can you see, when did he see Albers last?
I got a phone call saying somebody else is wanting to see me for pain clinic.
Okay,
So
I know that you have a lot of people involved in your care. Do you know if that was the VA pain clinic? It was
Correct.
VA, okay.
Yeah.
Okay,
it was a 3660 number.
yeah, okay. So that was generated by PA Aarons and I. We asked them to get involved and to give their opinions on what could possibly help you. So that was an extra kind of tentacle in this whole thing, all these offshoots of someone that we asked to get involved was a VA pain clinic, so,
Okay.
okay.
But that was never told to me. Nobody said anything. They just called out of the blue.
Okay. We,
Same thing with the pulmonologist. I didn't find out anything about it till Care in the Community. I was talking to them. They're like, "Oh, you're wanting to set up a pulmonologist appointment." Like, what?
And you're like, that's news to me, yeah. Okay.
Yeah.
Okay, okay,
It's just miscommunication
Yes, there-
over and over and over.
yes.
Doesn't seem like nobody cares about my mental health, because nobody's making me, like, helping me.
Thank you for sharing that with us. Communication has been rough because there are so many different facets, so many different people involved, so we'll make sure that we work on that in the future, okay? Okay. Were you able to see, or do we even know when he saw Dr. Alber's labs for pain?
No, they're not keeping us like up to date for each appointment.
Okay,
They kind of come in batches.
sure.
Did
So
you
I'll
guys get the file? They were supposed to send my whole entire file.
I have not seen that, but I would be happy to request those records, okay? I'll get those,
Well, they were supposed to be sending them already.
Yeah, okay,
I sent them last week.
okay.
Like, I wonder if that pile that I have on my desk, maybe?
Would you, it's up to you, I don't know, do you wanna go look?
Yeah, I can go look.
I don't know if that was from Albers or
Right.
not, I'm not
You
sure.
got it.
Sometimes, so you're well aware, with the VA, there's a delay a lot, so if it came to this building, it could be that it's not to our clinic yet, if it got sent last week, with the holiday and things, okay? So Andy's gonna go look at that. So pain control, so Andy's gonna get the records for pain control, so that was your first goal. A second issue that we talked about was transportation, so we have 2 representatives here from VA Transportation that would like to give some input and see if we can't work on that a little bit, okay? So I might turn it over here to Jordan and Bryce.
Okay, Bryce, I'll go ahead and start out, if that's fine.
Yep.
So I've been looking, Mr. Ari, I've been looking at your past trips and a little bit about our program, VTS. We are here to bridge the gap for veterans that cannot get to their appointments. However, we have to prioritize based on their medical needs, based on what your physicians are saying as well. So in our directive, the VA has certain veterans that we are obligated to transport, and those are special mode veterans that have a consult in there that says yes.